Good morning everyone. I'm presenting a paper on comparative study of intraocular pressure and central corneal thickness in pregnant and non-pregnant women of the reproductive age group. Corneal thickness is essential because corneal thickness is vital because it can mask an accurate reading of IOP, and IOP is overestimated with a thicker cornea and underestimated with a thinner cornea. Increased thickness is due to corneal edema, which makes it difficult to assess the refractive status. The aims and objectives of my study were to measure the CCT and IOP in second trimester of pregnancy and non-pregnant women of the same age group. Materials and methods were: this study was conducted in the Department of Ophthalmology at HIMS Swamirama Himalayan University over a period of 1 year after taking written consents. The sample size: a minimum of 50 patients who were in second trimester of pregnancy, that was group A, and 50 patients who were non-pregnant, that was group B, were included in this study. Total eyes were 200 eyes. The inclusion criteria for group A were pregnant women between the age of 21 to 35 years of age, pregnant women in their second trimester of pregnancy, uncomplicated singleton pregnancies, patients willing for ocular examination. Inclusion criteria for group B was non-pregnant women between the age of 21 to 35 years, patients willing for ocular examination. Exclusion criteria for group A was complicated pregnancies including pregnancy-induced hypertension, gestational diabetes mellitus, and thyroid disease. Multiple pregnancies, patients on topical anti-glaucoma drugs, and family history of glaucoma, or with previous history of any ophthalmic surgeries including refractive surgeries. Exclusion criteria for group B was comorbidities such as hypertension, diabetes mellitus, thyroid disease, patients on topical anti-glaucoma medication, and family history of glaucoma, any previous history of any ophthalmic surgery including refractive surgeries. In the IOP frequency distribution, it was seen in group A, around 78% of the patients had their IOPs ranging from 10 to 14 mm of Hg, and in group B, they had around 60 to 65% of the patients had their IOPs ranging from 12 to 16. The mean IOP for group A right eye was 13.6, left eye was 13.8. For group B right eye was 14.64 and left eye was 15.26. Their p values were significant. In the CCT frequency distribution for group A right eye, it was seen for group A, it was seen that from 65 to 70% of the patients had their CCT ranging from 561 to 580, and in group B, maximum patients had their CCT ranging from 541 to 560. The mean CCT value for group A right eye was 560.54, left eye was 559.98. For group B right eye was 550.46 and left eye was 552.9, and their p values were significant. In our study, we found that the CCT was more and IOP was lower in pregnant females as compared to non-pregnant females of the same age group. Discussion. F et al. In 2012 conducted a study where he studied CCT and IOP in first, second, third trimester and 3 months postpartum, and found that the mean IOP of the second and third trimester was lower and mean CCT was higher than that of first and 3 months postpartum. Satagopam et al. In 2022 studied the changes in CCT and IOP in pregnancy, that was second and third trimester women, and compared it to 3 months postpartum, and found a significant increase in CCT accompanied by a decrease in IOP in the pregnant group compared to postpartum. Conclusion: due consideration should be given when diagnosing glaucoma during pregnancy. Before initiating treatment, physiological variance in IOP should be taken in consideration. Novel spectacle prescription and refractive surgeries must not be done during pregnancy. Thank you. So NCT was used. So this was a drawback of the study, because considering that they were pregnant women and we did not want to use 80 because it is a contact method and we could transmit diseases.
No, I think.
No, so because it is contact, so
So,
like herpes
once you are
virus.
conducting a study of this significance, I think it would have been done because
Yes,
NCT is best as best a screening method.
yes, but in the previous studies, all the other studies also they had used NCT. There is no study that has been done with 80 till now.
So, what are methods of IOP measurement where you have corneal thickness increased? What are the best methods?
So 80 applanation
Other
tonometer.
other methods? What are, besides applanation tonometry? What are the other methods which can be used?